We will discuss about Omicron update. So we know this variant is causing pandemic in China. Nearly 248 million cases are reported once the COVID regulations are relaxed. What does it mean? It means that the COVID wave is circulating, the COVID virus is circulating, and it is developing new population, which are nothing but the variants or mutants, and which are causing this again a new infection. So I have cold and cough. It may not be Omicron always. This is a colder months, this December and January, and we'll face uh, common flu, which is more common when compared with Omicron. So don't worry about it. Do we have to get tested for common cold and cough? No, it's not required. Take some supportive medications like plenty of fluids, fruit juice, multivitamin, adequate sleep, rest, and little bit exercise. Don't use nebulizations at home. It's not going to help. And in fact, nebulization is useful for COPD and asthma patients. And if you have some allergic rhinitis or allergic bronchitis like that. Now, if you have not taken vaccines before, please take vaccination. It is going to prevent the severe infection and also death also. It is protective not only for yourself, but also for your family and also for the community at large. And so find out if your family members are not vaccinated and take them to the vaccination center immediately. So I want to explain little bit immunity with this diagram. Basically, if you see, normally with vaccination, we have some T cells which will destroy the virus. Whenever that vaccination is given, the T cell titers will come down. But after some time, there will be memory. It is called the T cell memory. Now, if you see, the again new COVID has come and it is multiplying in the body. Now, the T cells are also activated, the memory cells, and it will grow in a very large number. See how beautifully they are growing in a big population, and they will kill the cells, the COVID cells immediately. So this is what is called the immune this thing. Immune memory is there. So if you have taken a COVID vaccination, or if you are infected previously, your memory is there and it will fight back the virus. So don't worry about it. And what is herd immunity and population immunity? If you see this, there are a lot of people around, but the center people is not infected, the center person. So all these people who are like vaccinated or who are previously infected, they will save this center person. Like Padma Vyuham, you must have heard this like a Padma Vyuhan, like Abhimanyu here. Abhimanyu is not affected because as long as he is in the protection of the surrounding people, which is given by the vaccination or infection. However, if there is any breach, like when the protective people have moved away, then the virus can attack through this person. This is called herd immunity. And thank God, because of the we have achieved herd immunity in India because of the efforts of the government and also at the responsible citizens. So B57 subvariant is like because of the mutations we get alpha, lambda, and gamma. The virus continues to produce new variants as well in future. We should be prepared for that, but we are not sure if they are going to damage as well. So what is this escape immunity or neutralization resistance? What is escape immunity? You can see here the virus is being damaged by the antibody. However, in this image, because of the high immunity or immunity escape, the immunity escape is 4 times with this variant, Omicron variant, so virus is not killed. There is also high transmission rate. See, if you are using both the infected persons, carriers, and other people are using mask, the transmission rate is just 1.5%. So are we having any possibility of pandemic again? Probably yes. The Omicron is coming and it has spread a lot in China. Maybe we also have more cases. But is it a variant of concern? What is a variant of concern? The variant of concern means is a variant is going to cause a lot of disability like hospitalization or death. Then it is called a variant of concern. I repeat, variant of concern. So it might be a variant of concern or it might not be a variant. that is not concerning us. It is most probably because of the herd immunity, as discussed before. It might not be a concerning issue for us, and we have multiple layers of protection where we have personal responsibilities like physical distance, hand hygiene, limiting the crowd, and also shared responsibilities like especially in the apartment outdoors with good ventilation and quarantine and isolation of the infected persons. And along with that, using personalized face masks, government is supporting as well with vaccines and everything. Always remember N95 mask is for healthcare persons, or if one of your family members is suffering from COVID, you can use a N95 mask. Otherwise, surgical mask and the cloth mask are also better. In addition to the type of material used in the mask making, the fit of the mask is also important. In fact, the cloth mask, when it is three-layered, will also offer the good protection. That's all for this session.